This is Korean news for 2022. Corona vaccine mass destruction. Considering the current vaccination rate, it is expected that 70 to 80% of the 200 million will be discarded. Converted to an amount, it would be at least $3 billion to $6 billion, 3.6 trillion to 7.3 trillion won. Among them, I know that SK Bioscience has decided to purchase 10 million doses of the coronavirus vaccine, which has not been fully developed. Aren't these completely crazy people? If something like this happens in a general company, what kind of disciplinary action will the person in charge receive? I'm very curious. Let's find out until the end what kind of people will receive what punishment and who should receive the wasted blood tax from the people. Let's find out slowly. From now on, the WHO will review the conditions for the end of the corona emergency. The South China Morning Post reported on the 12th that health experts at the World Health Organization, WHO, have begun reviewing the relevant conditions for a FIAC declaration to end the international public health emergency for coronavirus. An anonymous source familiar with the matter said the WHO is discussing the conditions, timing, and method for declaring the end of the coronavirus in private. FIAC is the highest level of alert issued when a disease is considered to be a risk to the public health of other countries due to international spread according to international health regulations. Earlier, the WHO declared FIAC on January 30, 2020, about a month after the coronavirus was first reported in China. However, the source explained that they are not considering a declaration to end FIAC right now. In addition to the symbolic meaning of the declaration to end FIAC, WHO experts are known to consider several implications of the declaration. Currently, Pfizer and Merck & Company have agreed to allow production of generic drugs for their coronavirus treatment until the pandemic is over. Vaccine manufacturers such as AstraZeneca also decided to keep their vaccine prices low during the pandemic, so if the WHO declares to end FIAC, these benefits may be affected. Due to the spread of Omicron in Korea, the vaccine is in danger of being mass discarded. The Korea Centers for Disease Control and Prevention is considering changing the distribution guidelines for remaining vaccines. You're crazy about trying to dig. Are you a manufacturer? You can change the distribution guidelines at will, and the country is very much in a SARI version. As many of the corona vaccines supplied to nursing hospitals and facilities for the purpose of the fourth vaccination are in a position to be discarded, it is understood that the quarantine authorities are looking for ways such as sending the remaining amount to nearby areas. According to the Corona-19 Vaccination Response Promotion Team on the 22nd, if the vaccine supplied for the fourth vaccination in nursing hospitals and facilities is difficult to run out within the validity period, the government is making it possible to transfer the vaccine to another inoculation institution within the relevant metropolitan area. Previously, in February, the government supplied about 430,000 doses of Pfizer vaccine to 590,000 people eligible for booster vaccination, including patients and workers in nursing homes and facilities. However, as the number of confirmed cases surged due to the outbreak of Omicron, which started at the beginning of this month, the number of subjects for additional vaccinations has decreased or the vaccination schedule has been delayed. This is because the quarantine authorities do not currently recommend additional vaccinations for those with a history of confirmed coronavirus, and allow those in quarantine to be vaccinated after the quarantine is lifted. As a result, a significant amount of vaccines distributed to each local government are in a situation where they will be discarded. Pfizer vaccines have an expiration date of 31 days after thawing. In the case of vaccines supplied to nursing hospitals and facilities for booster vaccination, they thawed between the 19th and 23rd of last month and expire on the 21st and 25th of this month, when 1 month passes. Because it does. In the case of Gwangju, for example, from the 28th of last month, it was estimated that about 16,000 patients and workers in nursing hospitals and facilities were subject to booster vaccination and requested the amount of vaccine from the Korea Centers for Disease Control and Prevention supplied. However, those who have received the booster vaccination so far account for only 35% of the total number of recipients, or 5,800. With 7 out of 10 people unvaccinated, the remaining vaccine volume is inevitably discarded. Many of the corona vaccines supplied to nursing hospitals and facilities for the purpose of the fourth vaccination are expected to be discarded from this week. In order to minimize the waste of vaccines, the quarantine authorities have come up with countermeasures such as amending the guidelines so that residual quantities can be sent to nearby local governments. At a meeting on the 14th, the Central Disaster and Safety Countermeasures Headquarters discussed measures to minimize the disposal of the fourth vaccination vaccine. In February, about 430,000 doses of Pfizer vaccine were supplied to 590,000 people who were vaccinated at nursing hospitals and facilities, but the vaccination schedule was delayed as the number of confirmed and quarantined people increased due to the spread of the Omicron mutant virus from early March. Those who are confirmed or isolated cannot be vaccinated. Vaccines supplied to some local governments, including Jeollanam-do, will expire one after another from this week. The validity period of the Pfizer vaccine is 1 month from the time it is thawed. In this regard, South Jeolla Province reported on the 11th that there is a limit to using and inoculating vaccines within the expiration date. Jeollanam-do requested that the remaining vaccines be redirected to facilities for the homeless or vulnerable to infection, or the related guidelines should be revised so that other cities, counties, and districts can use them. Accordingly, the major headquarters revised the guidelines that allowed for the conversion and allocation of residual vaccine quantities to be assigned only to SI/gun/GUs so that it could also be assigned to SI/gun/GU. However, messenger ribonucleic acid mRNA vaccines, including Moderna vaccine, can be stored only in an ultra-low temperature cold chain of -20 to 70 degrees below zero. Stug. In addition, in order to increase the use of the vaccine, the health authorities have recommended that those who are not confirmed or isolated should be vaccinated even in the case of a cluster infection in a nursing hospital or facility. Local governments have been instructed to transfer and assign vaccines to necessary inoculation institutions if it is difficult to run out of vaccines within the deadline. On the 22nd, the Korea Centers for Disease Control and Prevention, KCDC, said, if it is difficult for the vaccine to be converted and assigned, it has been instructed to discard it according to the established procedure immediately after the expiration of the validity period to prevent misinoculation. He said it would be counted. I went to 10 places to buy an antipyretic for children, but I couldn't buy it. There is no one who can get the vaccine, so it is being discarded. As the cumulative number of corona patients surpassed 10 million, a shortage of antipyretic drugs in pharmacies occurred and vaccines were discarded in hospitals and clinics, resulting in a total lack of management. In addition to antipyretics, cold medicines are running out quickly. Sun, a corona-infected person living in Gyeonggu, Seoul, said, it's not easy to go to a pharmacy and buy cold medicine without a prescription. There are many cases of local hospitals and clinics discarding vaccines due to cancellation of vaccination reservations. On the 22nd, Kim, who lives in Dongjak-gu, Seoul, said, on the 23rd, all other reservations for vaccination were cancelled, so there was only one person left. Mr. Kim said, breaking infections keep coming out, and the quarantine pass disappears, so I was trying to not get it right. An employee at a hospital in Yunpyeonggu, Seoul said, I opened a bottle of Pfizer on the 22nd, which can inoculate 6 to 7 people, but there were 3 remaining and discarded. Accordingly, frontline hospitals are taking hard measures to reduce the amount of discarded vaccines. A hospital in Mapogu explained, starting from this month, we introduced the vaccination day system, and explained that the vaccine is only vaccinated on Tuesdays, Wednesdays, and Thursdays. Some hospitals have even posted the unopened vaccine quantity on the remaining vaccine reservation page and are taking reservations. The hospital said, it means that many people can come because we have ample stock. The Central Quarantine Countermeasures Headquarters explained, if it is difficult to use up the vaccine supplied for additional vaccination in nursing hospitals and facilities within the effective period, it is transferred to another inoculation institution in the relevant city/province to prevent discarding of the vaccine. In addition, the Ministry of the Interior and Safety and the local government consultative body of the Korea Centers for Disease Control and Prevention are encouraging those subject to booster vaccinations, excluding confirmed cases and quarantined ones, to be vaccinated promptly. The quantity of vaccines that cannot be assigned for conversion or that are inevitably discarded after the expiration date is expected to be identified through aggregation by city and province after the expiration of the expiration date. During a non-face-to-face briefing on the afternoon of the same day, the head of the vaccination enforcement team said, in the case of the vaccine supplied in the fourth dose, the validity period will expire sequentially until the 26th of this week. The estimate of the amount of waste will be compiled and announced at a later date. In the midst of this, as the domestic supply of the coronavirus synthetic antigen vaccine £510 under development by SK Bioscience is completed, it is expected that the development of additional domestic vaccines will gain momentum. In particular, if the first vaccine in Korea is made, it is expected to have a positive impact, such as being used as a necessary control group in the future clinical process. According to the pharmaceutical and bio-industry on the 23rd, SK Bioscience recently signed a pre-purchase contract with the Korea Centers for Disease Control and Prevention to supply 10 million doses of £510 to Korea. The total contract size is 200 billion won, which means that it will be supplied at the level of 20,000 won per episode. However, £510 is still an unapproved vaccine. Thank you for watching today. Please like and subscribe.